All right.
Steve the Hurricane, man. I am a huge fan of your videos, and we recently did a virtual session. We were supposed to come to Houston. Tom and I were going to come down from Care Plus Home Health,
Right.
and we were going to hang out for 3 days in Houston, Texas. I was excited. It was March, I think, 17th, 18th, 19th. And we ended up, because of the coronavirus outbreak, you decided that we would do it virtually instead, and it went really well. And recently, you came to our 25th anniversary down in Gaithersburg, which we really appreciate. I recognized this guy. I was like, "Holy cow! There's Steve the Hurricane." I see all of his videos and his YouTubes. I was like, "Man, there's the guy." So, yeah. But I appreciate you coming on. And today, I was just hoping we could touch on a couple of topics like marketing and a little bit about what the Hurricane, what your coaching sessions do, and how you help people in the home care industry, a little bit about COVID-19, and then we'll be set to go. So, Steve, thanks for doing this for me. This is always informative. Your videos are especially informative. As someone who is learning how to be a marketer for the home care industry, you've taught me a lot about how to be successful, about how to build relationships, and how to communicate effectively in person and digitally, and how to just cultivate these communities. But I'm always interested to see how you got into this business.
So my background, and thank you so much for this opportunity, Ryan. I really do appreciate it. It's an honor and a pleasure. And I'm glad that you watched the videos because as you said, when I first got into this, I had no idea what was going to happen. Even back before I got into healthcare, I always had sales and marketing jobs. So that was my experience, and then my professional education was theology. So I was
Wow.
a Judeo-Christian heritage major, and I went to school to be a minister. And so in 2005, that's when I discovered healthcare, and it was kind of the perfect blend because the pastoral training helped me be empathetic in dealing with people at the end of life. Conversely, all of my sales and marketing experience that I had selling knives, selling cars, selling dairy products to supermarkets and restaurants and so on, that gave me the marketing experience I needed so that this was just a perfect blend of everything together. And so I started August 15th, 2005 as a marketing representative for a company called Care Choice.
Yeah. Wow. So you've been in it for a while. 2005, I think I was still oh man, I was a senior in college.
Okay, good. I'm 39, so
Yeah.
not too old yet.
Well, yeah, well, you're a young guy and but you've had a lot of success in this industry and you've watched it grow. And many people are now trying to break into the home health industry, the home care industry all over the country because they understand that they can help people and it's lucrative. They can employ caregivers and it's a win-win for so many people. You're set up in New Jersey, correct?
Yes.
Yeah. So, um, I'm always interested, Steve, when fellow marketers like myself, especially when we're learning, we try to find the tips and tricks of the trade. And really, what you have done is cultivate a, a fundamental understanding of how to learn how to talk to people and build relationships. That's what it comes down to for me. And when I walk into a community, how you can be confident and you can talk about how your business is different and how it stands out. And you give people these resources to be successful. And even still, though, on the day-to-day grind, the daily beat, there's numerous situations that marketers like myself, sales professionals encounter that are these one-off situations. And I'll give you an example. And I was hoping that you could give some insight. Say if you build a great relationship with a community and sometimes there's hiccups in the relationship. Sometimes they want to, a caregiver may do something inadvertent and then the case becomes, they want to toss you from the case essentially because they're upset. And how do you work through that? How do you get through these kinds of these issues without burning a relationship?
Well, it's not easy to get through an issue without burning the relationship, but what I find in every scenario, Honesty is always the best policy. So you have to be honest, you have to be upfront, you have to tell the referral source as it happens. If something happens, you have to be on top of it. Response is everything. So we try to be as proactive as we can by putting our procedures in place and trusting our procedures, but sometimes the unthinkable happens, or the thing that you're not prepared for happens, and so you have to be right on it and then be responsive with it. So you always try to be proactive, but you have to be responsive in some scenarios too, and then you just deal with it, and you pick and choose your battles. In some instances, if I'm on the side of right and I have the moral ground, I stick to my guns. And if a referral source doesn't like that, it could be a temporary souring
Mhm.
of the relationship, but it doesn't sever it, because I was morally obligated to do what I had to do, and it was the right thing to do. Integrity is everything, and usually the referral source comes around. Now, on the flip side, if it's something that we completely botched and messed up, yeah, you have to make sure that they hear it from you. You come in, hey, this is one of those days where you're going to have to eat that humble pie, right? So
Yeah.
humble pie doesn't taste real good, but you come in, like a dog with your tail between your legs and your head down. I'm real sorry that this happened. Hopefully, this is not the first referral they've ever given you, but you have a long-standing relationship. And I find that in my experience and my clients' experiences, that if you had the relationship, and this is a one-off mess up, as long as you own up to it and you do your best to make it right, most of the time they're going to forgive you and move on, and then just make sure you do that next one right. You know what I'm
Sure.
saying?
In in marketing, we know that sometimes there's a law where there's a period of time where we might be out beating the pavement every day. We're following the hurricane's methods. We're talking to every person inside of a skilled nursing facility, and we're building relationships with every staff member inside of an assisted living or a CCRC, but they're just not giving referrals. They're not delivering. Steve, at what point do we just show our cards and say, can you help us out? Can you give us a try? What can we do to earn that trust? What can we do? We've been here 5 or 6 weeks and we really would like the opportunity. Is there a way to approach that and I guess a way that is not imposing?
So this is the whole reason why my company exists, Hurricane Marketing Enterprises. And I actually have in my hand, I'm holding a workbook. And so as part of what we do with the training, because what you said there, it's so deep. This is a semester. I call this Hurricane University. It's a 3-semester college level course,
Oh yeah.
3 semesters on how to do exactly what you just said. So to sum all that up, it usually takes me about 18 lessons, say again, 6 months, maybe 9 months for somebody to complete all of the training with it. To sum that up into like one sentence, it would be to recognize that it takes 8 to 12 visits with the same professional before that person makes referrals to you. So if I see a social worker at a hospital, I'm going to have to see her 8 to 12 times before she's going to start to refer me. Now, if I go once a week, that's 2 to 3 months. If I go every 2 weeks, you're looking at, 3 to 6 months time before I start getting my very first referral. Anything that comes earlier than that is a blessing, icing on the cake, but it's going to take that long. Now, go back to what you said with a skilled nursing facility, for example. Well, there's more than just one social worker in there. You have a director of nursing, you have an administrator, you have a director of therapy, you have activities and recreations, you have admissions and marketing. There's so many other professionals. It's going to take you 8 to 12 visits with each of those contacts
Mm.
before things start happening. And so, yeah, 3 to 6 months is the waiting game before it starts to come in. But it's almost like a faucet that was rusty, and you're turning that faucet. And in the beginning, you can't even turn it because it's rusted shut. So you're banging it with a hammer, you're double D40ing it, you're polishing it, trying to get it to go. That's months before anything happens. You finally get it to start to turn, and then a couple of drips happen. Then you finally get to go a little bit more, and then the drips start to come more consistently. You get it a little bit more, and then all of a sudden you get a steady stream, and then eventually you get the whole thing on full blast, and then it starts pouring in. But to get it to that pouring in stage, yeah, it could be 9 months to a year before that happens.
Same thing with hospitals. I remember you talked about this and one of your YouTube marketing videos at Steve the Hurricane. If you just type that in, you can find Steve right away, and he does short clips explaining how to help marketers and home care agencies like Care Plus Home Health. And I should say, incidentally, Steve, you also help you and Tom Najjar, our company's CEO and owner. You guys known each other for a long time, and you've
Long time.
worked together.
2012. We go way back to when I first started this company, Hurricane Marketing Enterprises.
And I believe you guys even put out a book.
Yes, we did.
Yeah,
Yes, we
yeah.
did. Why We Care.
Why we care. So we have marketers. Every day is a unique opportunity to build another relationship, talk to somebody else, and make a connection. We know first that we can't walk into a facility or an AL or a hospital and say, "Hi, I'm here. Here's a piece of literature. Now give me a referral." It never works that way. And if it does, then I would love to meet the person that it happened. I'm sure it happened once or twice, but never in my experience as a marketer for a home care agency. And hospitals are a little bit different. You talked about how you have to cultivate. It could take up to a year. And
Yeah.
I think one of the areas where I want to improve on as a marketer is to build those connections. And we know now that it's a stressful time because of COVID-19. It's difficult now to get into a facility or an AL. Everything's on lockdown. But I think eventually we're going to return to some normality, and we'll be able to resume building those relationships face to face. But working a hospital, you got to know where to go. It's a little bit more difficult because of increased security. So how can we begin that process, Steve? Is it even from home? How do we begin working that if we want to talk to a specific caseworker? What's the process for that?
The easiest way to do everything is to going through the lowest hanging fruit, which is the people that you already know. And so I love, like, a hospital is very difficult. It's like the sweetest tasting fruit, but it's the fruit at the top of the tree. You know, to get to that, you got to do some climbing. There's some risk involved and all of that. Whereas that low hanging fruit, you don't need a ladder. You don't have to climb it all. You can grab it. And so I like to start off with my relationships with what I call the three-legged bar stool of home-based providers. That's private duty, home health, and hospice. All three of them, we take care of people where? In the home. So it's easier to find the representatives and the liaisons for those type of organizations initially. Get the referrals going between them, create what I call a power partnership with them, and then ask them, once you have a working relationship and you're referring back and forth, this could take 3 months in itself. But once you get that going, then you say, hey, where are you getting fed? Where do you make rounds? Who do you know at X, Y, and Z referral source, or, you know, John Doe Hospital that I'm trying to get into? Do you go there? Oh yeah, I go there all the time. I pick up referrals, 3 or 4 times a week at that account. Next time I go in, I'll bring you with me. Or if they're not able to go that far, they might say, I can introduce you to the director of case management. I can get you a meeting or something of that nature, because we have a solid partnership already happening. And if we're working together, and this is a phrase that I repeat over and over again, it is a interdisciplinary team approach to providing care. So I'll repeat that. It's an interdisciplinary team approach to providing care. So if that three-legged bar stool, home health, hospice, and private duty, if we're all working together, that is an interdisciplinary team. So if I'm getting referrals from the hospital as one piece of that team, I want to introduce the rest of my team to the hospital as well, because together we take care of all of the discharges. And so that team approach, where it helps one company out and another company by getting in quicker, that is what I find is the most successful and the shortest amount of time it takes to get into a hospital.
Steve, we're sitting at home. Most of us are working from the confines of our kitchen tables, or in my case, a home office. But I know that I am still out. I'm taking the necessary precautions using PPE, masks and gloves and facial gear, and we're delivering that to our caregivers. And the marketer's job could change day to day, really, in this situation. We help out, and as a small business, we help out wherever we can, whether if it's recruitment, if we need an influx of caregivers, I'm going to shift over and help our HR director, our operations team. And it's great because we get to be cross-functional and we learn a lot with that respect. But as far as marketing during COVID, and you talked a little bit about this on your seminar, how to make it happen, how to stay in touch with people. How, do you have any hints or tips as people are wondering, like, man, I'm doing videos and I'm sending personalized messages and texts and calling, but is there anything else that I could be doing?
Yes. So interesting enough, one of the things I go over in the Hurricane University in the second lesson of the 18 lessons that are part of that courses there is what I call the formula for success. And the formula for success, where every single week I have to do X amount of activities, X amount of face-to-face, Y amount of meetings and lunches and all of that good stuff. And you put it together, and if I do that every single week, I'm going to be successful. And then you enter about 8 weeks ago with the whole COVID-19 pandemic, and everything became lockdown, and you can't do this and you can't do that. And now today, 8 weeks after all of that began, I have spent hours and hours and hours training all of my clients on how to still do the things that are in the program that I wrote almost a decade ago, modify it by doing things virtually, and then doing things outdoors, and still get the same results as if nothing ever happened. So yes, it is a combination of videos. Yes, it is a combination of phone calls and emails. Yes, it is a combination of collaborating on things that involve outdoor activities and visits and all of that. You have to do the work. You have to execute. You do have to get out there. 90% of my clients are still getting those face-to-face visits, not inside the community, but outside in the parking lot and through meetings that they're setting up. They're doing Zoom calls the way that you and I are doing a Zoom call now, and they understand the communication talking points as to what is the value proposition as to why you would send patients to me, and they hit that right on the head. And the referral sources understand, and they send them referrals. So in a nutshell, it's being as creative as possible, but it's still following the same structure that we always have, just putting a different spin on it because of our inability to actually physically be there face to face.
Yeah, you're right about being as creative as possible. I've learned that you have to separate yourself from other marketers, and that our competition, they are equally working just as hard. But there's many Montgomery County agencies. Yeah.
I'm gonna go like this because I don't know. A lot of them are not working as hard as you'd think. So
Well, we're beating the pavement, and you know Tom's work styles, and you know
yes,
his ethic.
you are working harder than your competitors.
Well, we're trying to get the message out about how Care Plus can certainly help people and stay in their homes longer, or to live better in a community, and that how our caregivers can just sustain a quality of life that they may otherwise not have. And that's what it's all about. That's why I got into this job. And I knew that I wanted to do something with senior care. I have grandparents. My granddad's 94 years old. He'll be 95 in July. He's a World War II veteran. And this is my mom's parents. And my grandmother is 87. She's had Alzheimer's for about the last 10 years, but it's gotten progressively worse. And we are facing these decisions every day about how to provide better quality of life, how to provide better care for my family. And I mean that it's emotional too, to talk to family members, because they're here on the most vulnerable times of their lives. And we're not just selling. I mean, we're here to be a resource. We're here to be their crutch. We're here to walk them through every step of the process, just to ensure that mom or dad has the best possible quality of life, even when when maybe they're in hospice care. And I really got into this job and this career because I love working with senior citizens. and I love helping people. And what better opportunity to serve them in this capacity? And I think we all get, I've made relationships with lots of nurses, and this week is National Nurses Week. And I want to give a big shout out to all the nurses out there who are on the front lines, who put themselves in harm's way and who are courageous and just tirelessly helping people. Man, and Steve, I'm sure you've met tons of people in this industry, and you hear some of these stories that just impact you, that change your life.
Absolutely. I mean, I'll tell you right now, speaking to your point on that, this actually right here, this is a prayer list of all the names and people that have asked me to pray for somebody else. And a lot of them are nurses and physicians who are on the front lines right now, and the true heroes of the time. It's interesting. We're not looking at Super Bowl champions and NBA all-stars as the heroes right now. We're looking at the people who are actually saving lives, making a difference out there. I've met many nurses. I've met many doctors. I've met many caregivers, many home care business owners, and every single one of them has one thing in common. It's this innate desire to help someone else. It's not, regardless of what their condition is. Some conditions are preventable, some conditions are not. Somebody is in need, I'm going to help them. That is the oath that I took. That's what it's about. That's why I'm here. And so that's where I love being in the healthcare industry. And then not related to that, but the other part of what I love about being in the healthcare industry is from a business standpoint. When I had my company Care Choice, I started out as a marketing rep, as I told you, but by 2009, I became the vice president and part owner of it. And then by 2011, we flipped and sold that company for several $1 million.
Yeah.
Now, that whole experience during that time that I just mentioned, you may remember, that was like when we had a really big recession. And the housing market crashed, and real estate was through the roof, and unemployment was super high, and it was scary times. And yet, even though that was happening in the world, my company, Care Choice, we still grew double-digit percentage year after year after year. The thing that I love about healthcare from a security standpoint is it doesn't matter what's going on financially in the world. Need always exists. And so from a business standpoint, from a service standpoint, I mean, I went to school to be a pastor. You could see above me here, this house that I live in, this is the house of the Lord. And it allows me to fulfill my purpose, my passion, and have the security that I don't have to worry about, what if my industry goes down? It's never going to go down because we're in the business of taking care of people. So it's like the best case scenario for a profession to choose,
And speaking of taking care of people, our most important function in our agency today, yesterday, and 5 years ago is to take care of our caregivers, who are in turn taking care of our families and being those frontline support for the communities and family members. And we're trying to do everything that we can every day, every minute, to show our love, our appreciation for their sacrifice, for their service, for going into situations where they know that they risk being COVID positive with different clients. And we're doing everything that we can possibly do to express our gratitude. Steve, as a business owner in general, what can we do more to show how our support for our frontline healthcare employees?
So to show the support for the healthcare frontline caregivers right now, it really comes down to mindset. So I have this image that I share with a lot of our clients of the right way to run a business and the wrong way. Now, the wrong way, you may have heard of like a pyramid scheme before, right? So I love using the graphic of a pyramid where it's like at the top of the pyramid, you have the CEO, I'm the boss, and everybody works for me, and blah, blah, blah. Then underneath that, you have your office staff, then you have your caregivers, then you have your clients, and that's your pyramid. The right way to run your business as an owner is to flip it from a pyramid to a funnel, right? And with a funnel, you're still the point, but I am responsible for everybody above me. So I, as the owner of the organization, I will spend the vast majority of my time supporting who? The people closest to me? My office staff. I then in turn have my office staff and I support them so that they have all the time, resources, and energy to support the next level up, which are the caregivers. And then obviously the caregivers, when they're properly supported and taken care of and happy and everything else, they in turn support the patients,
Right.
our clients, and they take care of them. So we're looking at it as a funnel. If there's a chink in the armor somewhere, it all falls back to me anyway, and I have to pick up the slack and help out and support. So I'm there to support everyone. Sometimes I have to jump up a level and take care of the caregiver. Sometimes I have to jump up a level and go to the client. There have been many times, I know I've done this, I know Tom has done this, I know many other home care business owners. I've picked up a client and drove her home from the hospital before and stayed with her until our caregiver arrived. Yes, I have done that. We do whatever we take and whatever we can do for our patients. When the caregivers see that, when the office staff sees that the owner is willing to do this, then it changes the culture in your organization. And then you get the, you know what, I'm here to help. And you start to attract the right caregivers and you attract the right office staff, and then you attract the right clients. And so it's very methodical on how we do that. But as long as we are there to support them, they will be okay. In the COVID situation, yeah, you got to have the PPE. You know, if you're going to have a case where somebody has COVID-19, and this is what I've seen across the board, I have seen many people charge a premium because you're going to pay that caregiver more. It's a volunteer situation. You're going to let the caregiver know, hey, listen, this patient is COVID-19. They need your help. Are you willing to do it? I can give you X, Y, and Z instead of your regular salary because we're going to charge more for it because you are putting yourself at risk. What do you say? It's a volunteer. They take it. Then I got to make sure I got the proper equipment. You got to have the booties. You got to have the gowns. You got to have the gloves. You got to have the N95 mask, the goggles, the face shield. Like, you have to be completely covered and make sure that they have a new set for every beginning of every shift. So all the extra cost, that's why you charge the premium, because you have to. But you have to dot your I's, you have to cross your T's. You got to give them certain benefits. If somebody becomes asymptomatic and they're contagious potentially, even though they don't have it themselves, you got to give them salary for that 2 weeks of quarantine and just take care of them. Like that's the right thing to do to support those caregivers who are on the front lines. And they'll keep coming back and they'll do it because you're doing right by them. And so they want to do right by you and do right by your patients.
To have to take care of our folks who are on the front lines. Steve, in addition to working with home care marketers, how can your services and your training and your seminars and your handbook, the Bible of marketing for healthcare, I think. Yeah, exactly. How can you help guys like not exactly another handbook for life? That's our guide, man.
Amen.
How can you help other people in the industry, maybe marketers for assisted living communities or memory care or hospital liaisons or marketers for hospice? How can you reach out and help those folks with your services?
So I'll tell you what, first and foremost is a two-part answer. So the first part of the answer is we started out, and I know the name is Hurricane Marketing Enterprises, and we go by the AKA Home Care Marketing. That's the other name that we have. We work mostly with business owners. We work mostly with the home care business owners, executive directors, office managers. We do programs where we work with schedulers and recruiters. So really, it's about scaling the business. That's how we call it, the marketing. That was our initial, phase when we started the company 8 years ago. But we have grown to making it everything you need to scale your business. And so there's so many other aspects of it. When we first started working out with people and giving them marketing support, we quickly realized they couldn't handle patients that were coming in because they didn't have the operations support. They didn't know how to schedule properly. They didn't know how to recruit. They didn't know this. They didn't know. So we've made it a complete umbrella package on how to scale your home care business. Now, the second part of it, to your assisted living, to your hospices, to your home health companies and the other ones that exist out there in healthcare, yes, we work with you too. How? Because it's all about getting in front of who has the patient you're looking for. If you're looking for a physician, we help you get in front of the physician. If you're trying to get into a hospital, we help you get into that hospital. And it doesn't matter if the hospital already has the level of services that you represent. So if I represent an assisted living and the hospital has their own assisted living, great. That assisted living may be able to hold 100 residents, but that hospital, the average hospital across the country, discharges 2,400 patients a year. They can't handle all of the business that comes out of the hospital, and they have overflow. So we work with you on how to make these relationships and the connections and the contacts. It doesn't matter what you represent. Making a relationship is making a relationship. How to get in front of the key contact you're looking for and leveraging other relationships to be able to do that, it's universal. And so as a result, I've spoken at many conferences for assisted living, for hospice, for home health. I've even spoken at hospital conferences. I did a partnership for 7 different conferences in 7 different states with Partners Pharmacy. Because they, as a pharmacy representative, they spoke to everybody. And I was their keynote address speaker at every single one of those symposiums, because it is universal to be able to develop a relationship. And one skill set doesn't replace another. It's universal straight across the board.
Steve, you've worked with many different aspects of the healthcare, home care. What do you think are one of the more common misconceptions about home care agencies? If you're approaching it from the outside and they're looking in and they see marketers, sometimes people say, oh, I don't know. I don't want to, here's this guy, he's come in and he's showing up and he means well, but we just don't know how to talk to them. And they may form that misconception, even though if we are working hard and trying to build that relationship. What do you think? What do you think what can we do?
So it's very difficult. I mean, this is the reason why we're in business here, because it's not easy to get in front of these accounts. There is a very big stigma with private duty home care. And I'm going to say the stigma is justified, because from my experience, like 25% of the home care businesses that are open shouldn't be in business.
Right.
They eventually go out of business. That's 1 in 4, right? So if you're a hospital discharge planner, if you're a director of nursing at an assisted living community or whatever walk of life you come from, and you see all these home care representatives, you see all these business owners coming in asking you for business, and you know that many of them fail and they mess up and they don't do things the way that they should. That's the reason why the good companies, representatives like yourself, or when I first got started, we have what I call inheriting the sins of the father, right? The people before us who messed it up make it a lot harder for us to get in front of them. And so the first tip that I would give for somebody is to ditch the term non-medical. Just ditch it. Even though, yes, we're not doing injections. Yes, we're not doing tube feedings and trach care unless we have a skilled, license for that. And then that's skilled care. So it's non-medical. You don't ever want to be non-anything. All right. So if you're non-medical, then they're not going to take you seriously because you're talking to a medical professional.
Well, I'm a non-smoker.
What was that?
I'm a non-smoker.
Right. Well, okay. I'm a non-smoker as well. But when it comes to private duty, you be a private duty. We are a private duty. Now, one of the other terms along the same lines that I like to say from private duty, and I teach my clients this, you're looking for the medically complex case. This is why you need the interdisciplinary team that I mentioned about before. If I'm working with the home health, they take care of the skilled component. We take care of the custodial care, i.e. Toileting, transfers, bathing assistance, meal preparation, medication. We do all of that while they do the skilled component. That's the interdisciplinary team for the medically complex client. So the second tip would be get medical. Don't get medical meaning you don't have to be a nurse or a doctor. I'm not a nurse. I know more medical terms than the average Joe. I know almost as much medical information as a nurse does at this point, maybe not doses and medications
Hmm.
specifically and what does what, but somebody tells me a diagnosis, I know exactly how much help that person needs, how many days a week, what they have to do to set the house up properly, where to go for the equipment, how to coordinate. I know all of that stuff from now 15 years in this business. So educate yourself on all of the medical terms, all of the medical procedures that take place, the type of conditions that your patients have, so you can speak intelligently to a medical professional, and then they're going to take you seriously. You will be different from the other marketing reps who just come in, hey, you got a referral for me? No, let me talk to you about something I do all the time. I know you guys have done this, specialty programs,
Yeah.
right? So I have here in my hand, this is one of the things we teach our clients, how to
Okay.
create a sales presentation. And as part of this presentation, one of the things we do is we teach them about creating specialty programs to differentiate yourself from your competitors. So here's an example of like a fall prevention program right here,
Hmm.
or an orthopedic program. So I'm not just going out there saying, hey, send me anybody. No, here's my orthopedic program. And for the orthopedic patient who has a hip replacement, which is like a 3 to 6 month recovery, they're going to need X, Y, and Z. And so now I'm speaking to the medical professionals who are on the other side, discharging the person, knowing that they need X, Y, and Z. And they're like, so you have all this set up for your patient when they have a hip replacement? Yes, we do. I'm going to send you all of my hip replacements going forward. Great. And that's my foot in the door. So there is, even though it's non-medical, it's really private duty taking care of the medically complex, that interdisciplinary team approach, specialization, and then delivering on your promises. Do what you
Absolutely.
say you're going to do. Done.
Absolutely. And if I could give someone today 3 takeaways, whether you're in home care or you're in, and we're working you're in an AL and you're a marketer there. One is that I've learned from you, Steve, and being in this industry, even for a short time, is to always create value. My job as a marketer is always build value, always create it first, and show how you are a hub, a resource. It's not just walking in and asking for something. It's showing people that we are a wealth of knowledge and that we will walk them through any imaginable healthcare situation for their aging mom or dad or for themselves. And the second thing is that when we create value through our specialty programs, Care Plus, we specialize in Parkinson's care. We do dementia. Most of our caregivers have some form of dementia training, and we work with a lot of behavioral cases. We have a wealth of men who are caregivers, and that is a need today, that some older gentlemen prefer a man just to maintain their dignity, just like my granddad would if he would go to the restroom or whatnot. It's just a preference. And the third thing is that we're here to support the community. We're not just here with our hands out saying, give us something. We are a family in the home care industry, especially in Montgomery County. And while it is competitive and while we do want to increase our business, we understand that our service is more than it's a service. We become like family to our clients. We treat our referral sources like family. And it's all about just supporting one another and helping one another, especially now during COVID. So Steve, why don't you leave us with a final thought? You're an inspirational person. I've learned a lot from you. So leave us with a final thought and how people can get in touch with you.
So the final thought would be, stay consistent. Stay consistent. I'll make it 3-part, right? It's consistent, it's persistent, and then just walk in integrity, right? If I am consistent, where every time I come in, I'm the same person as I was last week. There's nothing fake about me. I am who I am. And then I'm persistent. I'm never giving up. I'm remembering it takes 8 to 12 visits before I start getting referrals. That's an average. Sometimes it's 5. Sometimes it's 24, right? So I have to be persistent. And then, walking in integrity. Even if people don't like it, if you do the right thing, people will respect it. There have been many times over the years where I've ruffled people's feathers, but I was on the side of right. The person who didn't like it, they were upset about it for a couple of months. But eventually they came around because I was consistent and I walked in that integrity. And that is, if you're in integrity, you're doing right by your patients, your intentions, and you're delivering, you will always be okay. So those three things: consistent, persistent, integrity. And you can
Steve?
reach me,
Yeah.
like you said, find me. Steve the Hurricane is my name. If you Google search it, I think somebody made what's it called? Wikipedia about me now. So
Nice.
it's a brand, it's a brand now at this point. I have hurricane everything. I even have hurricane masks are coming in tomorrow. I'm so excited to wear my hurricane mask.
That's
But
awesome. So some
um,
hurricane, so the actual facial masks.
yes, yes.
Nice.
I bought a bunch to see how it goes. I want to give it to my wife, my kids, and my staff, so they all have them. But I got a feeling people are like, I want one of those. I want one of those. So I might buy like 1,000 of them and just give
Nice.
some out to my clients or whatever. But the best way to reach me would be to go to my website, homecaremarketing.net. homecaremarketing.net. And when you see everything there, you can find me on any social media. Just look up Steve the Hurricane. You'll find me there. And then just communicate with me. We're here to serve.
CarePlusInc.com is our Care Plus Home Health website, and Care Plus and Hurricane Marketing, that we have been simpatico. We have worked together for quite a while. I have learned a lot from you, and I always appreciate you helping me to become better in my career and to really better reach people and connect on an emotional and mental level of just working with somebody side by side to get the best possible outcome. And Steve, I really appreciate your time. I know you're a busy guy and you made time today for this, so it means a lot for us. And I'm looking forward to the next opportunity to see you in person. Maybe this summer, maybe we could, are you guys doing something?
It's a maybe at this point. The next definite one will be in Houston at the place where it was supposed to be held back in March, and it'll be November 16th, 17th, and 18th. So November 16th, 17th, and 18th in Houston, Texas. That's the one that will definitely happen. The one over the summer, I don't want to say yes to that because I have to make a decision in the next week or two if we're going to have it. And from what I've heard, just with people and everything with COVID-19, it's like half are telling me yes, half are telling me no, and I got to look out for the protection of the audience. So we'll come back to that one, but definitely Houston, November 16th, 17th, and 18th, 2020.
Well, if you want to learn how to build relationships and grow your business and build those community connections, there's no one better who can help you do that than Steve the Hurricane. Steve, thanks for coming on to talk with me today. I'm going to share this and try to add some value to people's lives. I appreciate you. God bless you, my friend.
God bless you too, brother. Thank you so much. This was fun.
Thank you.